Fever is one of the most common illnesses around the world. But how is it defined? Fever, also referred to as pyrexia, is defined as having a body temperature beyond the normal range. What are some of the main causes of fever in India? They can be bacterial, like pneumonia or typhoid, parasitic, like malaria, viral in the form of dengue, SARS or chikungunya. Malaria and dengue are seasonal illnesses, with the number of cases rising rapidly, mainly during the rains. The most recent type of fever is the one associated with COVID-19. The corona fever is highly contagious. It can spread rapidly among a demographic, and no definite treatment is currently available. HORIBA plans to support hospitals and clinics by helping fever clinics to take the load off them and reduce the risk of transmission to other vulnerable patients. A 4-step process of screening, investigating, consultation and management will be followed at every fever clinic. Patients with various grievances will visit hospitals or clinics. All of them will be thoroughly sanitized and made to pass through a thermal scanner. The thermal scanner helps detect an individual's body temperature. Those with body temperature above the normal range will be directed to the fever clinic, while those with some other ailment will be directed for their respective treatment. This keeps the crowd moving steadily. An individual complaining of fever will undergo some basic investigations. Only one person will enter the investigation lab at a time. Other patients will be seated in the waiting area at appropriate distances. A patient will undergo some tests like temperature check, SpO2, CBC and CRP, lymphocyte count, chest X-ray. The overall investigation would take about 30 minutes. Time is a crucial factor in this process to avoid crowding. Once we have the results, the patient will have a one-on-one discussion with the doctor, basis which he or she will be classified as COVID positive or negative. A COVID positive patient will be transferred to COVID facility for further investigation and treatment. At the facility, a patient will be diagnosed, monitored and managed to assess the stage of his or her infection. Clinical symptoms and signs of COVID intensify with each stage. A patient with any other kind of fever will be directed for their respective treatment. HORIBA's one-stop solution for fever and COVID management is called PSN. Rapidly assess and refer people COVID-19 symptoms. Reduce the impact on scarce health resources through use of a controlled triage system. Initiate isolation for confirmed, probable or suspect cases and quarantine the close contacts. Advantages of fever clinic, OPD, lab. HORIBA stands strong to support healthcare facilities like general physicians' clinics, at emergency departments in hospitals, etc. to support the country's medical system. HORIBA joins the fight and stands strong against COVID-19.